Hello everyone, my name is Dr. Dvoskin. I'm here to talk to you today about potential causes of pain after either a motor vehicle accident, a slip and fall, or a work-related injury. There are many different reasons you may be experiencing shoulder pain. Shoulder pain can be due to a blunt trauma, a sharp trauma, as mentioned earlier, a fall. Shoulder pain can present itself in many different ways. One way, it could be a dull and annoying aching pain. Maybe you're not getting the sleep that you used to. Maybe you're just rotating and turning onto the shoulder and now it hurts when it never did before. It may be bothering you because you're not able to lift your arm above your head, or maybe you're not able to reach behind your back when showering. A lot of different things can go wrong after an injury. Some of them are more serious than others. For instance, one very common problem that patients have after an injury is an inflammatory response. Whenever we hit our arm, our leg, you always notice it may bruise and it gets black and blue. Well, you could also have an internal injury to the muscles, to the ligaments or the tendons, and you won't be able to see it, but you'll feel pain and discomfort. In medical terms, we call this either tendinitis or bursitis. It happens to multiple regions in the shoulder joint itself. The shoulder itself is made up of 4 rotator cuff muscles, and when injured, you will have trouble moving your arm. Other things that can go wrong from an injury in a more severe sense, you could always have a fracture of one of the bones that make up the shoulder joint. And in very rare cases, you may even have a death to the bone called avascular necrosis. This can result if you've injured the blood supply to that joint. Sometimes you've seen and probably heard that patients get dislocations. You'll feel that the joint is out of place and you may need to have it reset manually. We can also tear the muscle. We can also tear the ligaments. We can even tear the tendons. Depending on the degree of the injury will be proportional or sometimes out of proportion to the pain that you experience. You also need to get a proper evaluation. If you have a full tear, that's something that needs to be addressed sooner than later so you could regain motion of your shoulder joint. Additionally, you may have, through time, lack of range of motion because the inflammation persists and you're developing adhesive capsulitis. This requires prompt diagnosis and starting physical therapy right away. You may also have an injury to the nerves. You may be experiencing numbness, burning or tingling going down your hand after you've injured your shoulder. Some of the main nerves from our neck travel right under our shoulder in the armpit region and go down our arm. This also requires very prompt diagnosis and evaluation. It consists of imaging studies, a full neurological examination, and at times a nerve conduction EMG test. These things combined will help you make the better diagnosis, accurate diagnosis, and then pick the best course of treatment for you. So don't hesitate after an injury. You need to get evaluated. Make sure you see us at Injury Doctors NYC for a full proper evaluation and management.